Pediatric surgery plays a vital role in safeguarding children's health and future. It is not simply adult surgery in smaller bodies. Children require specialized care to correct congenital anomalies, treat childhood diseases, and manage injuries.
If we didn't, we would lose his kidney.
These interventions support proper physical growth, relieve chronic pain, and ensure that young patients can enjoy a higher quality of life well into adulthood.
Knowing that we have a solution of doing
This is the whole purpose of Professor Paddy Dewan's 28th visit to Papua New Guinea.
You're right?
Yes.
Welcome
back home.
We're both younger.
not only to treat the children, but to work with colleagues that I've known for many, many years, but with the sense that what we're doing is we've been working at developing paediatric surgery for a long time. This feels like we are going to make it a centre of excellence for the region because of the drive and enthusiasm of the people from Paradise. So that's the difference, that it's a centre of excellence for the region, not just the care of children here in Papua New Guinea, which is obviously the most important thing first, but it is going to be so good, I feel, that it means that we can actually share that expertise with the rest of the region, because the level of care will be at that standard where it will be better to come to Papua New Guinea for paediatric surgical care than go to Australia from the region because of the commonality of the conditions that are being treated.
The first patient in the week-long series of complex surgeries was Mercy Alex, who suffered from severe congenital bowel and intestinal conditions. After 7 unsuccessful operations locally, Mercy finally underwent a 10-hour life-saving surgery performed by Professor Dewan in collaboration with Paradise Private Hospital specialist Dr. Kennedy James.
So you can see her colostomy here, so she's still got a very scarred abdomen.
Her father, Alex Siosi, reflected on the long years of hardship his daughter endured since her condition was first discovered, describing the journey as one filled with pain, resilience, and hope for a healthier future.
People been expecting also one bla man also doctor by camp, professor by camp na. Today as the time we play sinalo here, mama mi sorry na mi tu sorry hamama sorry na mi play tu hamama sorry and come sorry lo here too mi play sorry na mi play hamama at the same time, because I think this is the day and the time that we are waiting for, and it has arrived, and we are just so glad and happy that now she is going to fully recover. She is very happy, and she wanted to go back to school. People like go put him enroll him name blame, but problem time I'm going to the classroom and smell now or pain also isolate him. But people like told no can worry, you'll be okay. Now you go back to school. So with full high expectation. One time faith na confidence na trust me play believe also this la legally go back lo this la process lo today she will be okay. She will come to a recovery, full recovery. And this la so me talk thank you lo line lo Paradise Hospital lo here the boss Mary and Misanap and me good plan Mary, her reception was very good, and me also giving me plan moral boost. When we play Hamamas in Salo Bell, me play also. One and something doctor I can make him lo here. Any other brother or sister or Lily beginning to his stop. No one him hap. Now you heard him this last story or you read him this last story too. Paradise Hospital can provide that kind of a service to make sure you are healed. At least all he can provide him this la kind of service will help him you. And this la beginning where you suffer or this la kind sick now is stop.
Dear friend, today will be your big day, and I want you to know that you won't be alone. There will be kindnesses and doctors beside you to make you feel better and they'll be taking great care of you. I want you to know that you are stronger than you think you are.
Following Mercy's successful surgery, Professor Dewan and the local medical team continued performing additional complex procedures throughout the week. His visit was made possible through a partnership with his non-governmental organization, Kind Cuts for Kids, which is dedicated to delivering sustainable, specialized healthcare for children in developing countries.
The staff that I'm working with, some of them I've known from previously. Kennedy James I've worked with in Alatau. Titus Pakop is another surgeon who not only have I worked with him here in Papua New Guinea, but he has travelled with the organisation that I've worked with for many years now. It's Kind Cuts for Kids. He came to Zimbabwe and South Africa as part of what we've tried to do is not only have visits to Papua New Guinea to see what the problems are here, what the solutions are in this country, but to take the surgeons from Papua New Guinea to other locations so they see how to do outreach. So outreach to another country, but teaching them how you go about it to do outreach in your own country. And that's been one of my dreams, is to have people move around the country to provide the services so the care is equally good throughout the country. And so that Titus went to Zimbabwe and South Africa. Mackley Matthew, the first paediatric surgeon here in Papua New Guinea, came with me to Mauritius. And one of the surgeons who's previously been a chief surgeon came to the Middle East with me. So it's been trying to develop that concept of outreach, the skills in outreach.
So this is one of your
This is the
stories. Yeah. How does that make you feel?
This visit also saw Professor Dewan conducting specialized first-hand training for the local team.
Her being a teenage girl who was dirtying herself all the time to a teenage girl who was confident, and she's been confident ever since. So I sent her 10 years after that operation.
This training was to transfer advanced surgical skills to the local team and upskill provincial surgeons.
But also working with the complex patients that we've worked with this week. And one of the very important concepts that we've developed is how to do things very precisely with the techniques that get the best results, but also using as little resource as possible, not just to save money, but to make it actually better for the patients. The first patient we did, the most complicated patient that we've done, has had 7 surgeries before, but has had the problem of when complications have occurred, there hasn't been the responsiveness to the complications because of guest lack of experience, but also what is around the world in medicine, a little bit of a deficiency of attention to detail and sailing close to the wind, as sailors might say, where every moment you have to be absolutely particular with what you're doing so that you use less resources, you have less suffering with the patient, so that you expect all the complications that might occur. So as soon as they occur, you're onto it. So teaching that mentality and then working through, for that girl, it was a very long operation from the start of the anaesthetic to the finish. It was about 9 hours, but it was a lot of time where we were moving less than a millimetre at a time to make sure that where we were going next was exactly where we wanted to be. And that's a little bit like the analogy I use of driving on a mountain highway that's rough and it's snowy and it's wet. You have to absolutely concentrate and every movement has to be perfect. otherwise you'll crash and burn. And so that's what we were showing during that operation, with the girl talking afterwards, so superb anaesthesia, so that she was able to wake up well after such a long operation, and sort of smiling and talking to us the following day, because of every little step, every minute micrometer was done in a way that meant that we got a positive outcome from that.
In celebrating the hope and healing brought by Professor Paddy Dewan's 28th visit to Papua New Guinea, his dedication alongside the local specialists has not only saved young lives but also strengthened the skills of our medical teams for the future. Mercy's story to the many children who will benefit, this milestone reminds us that pediatric surgery is more than medicine, it is a promise of brighter tomorrows.
A lot of our surgeons, and in pediatric surgery, we need continuous mentoring and leadership. So we will take over that leadership role, but at the moment, because it's a new field, so we need more of his guidance and leadership in that field. So with the way forward for Paradise and the country, we are signing MOU with him and Kind Hearts for Kids. So we hope to bring him 2 or 3 times a year to the country, and we might expand to the provinces in the future. We want to thank him because he travels throughout the world, and the experience that he has in other countries, in Europe, in Africa, in the Americas, and when coming here, he teaches us those techniques and the skills that he developed over the years. So we are very privileged to have him in Papua New Guinea. He's a well-known pediatric surgeon and a urologist. He does exams for specialists in Africa, in Europe, and in the Americas. So we're very privileged to have him mentoring us as Papua New Guinean surgeons.